And joining me now to discuss the lasting effects of Columbine and other mass shootings is Dr. Ziv Cohen, Clinical Assistant Professor of Psychiatry at Weill Cornell Medical College. Thank you so much for being here, Doctor.
Absolutely.
When you hear what happened today with this 18-year-old woman who came to the Denver area, who had threatened schools, who was infatuated with what happened at Columbine, so close, right in the community.
Right.
What kind of impact must that have had on the people who lived that 20 years ago?
Unfortunately, one would expect that it would have a pretty profound impact in terms of an anniversary is a time when people who are traumatized are going to have a heightened sensitivity, be more likely to experience symptoms related to that trauma. And so if someone is threatening them or there's a recurrence of that kind of event, we would expect a reactivation of those symptoms. So it's a very concerning type of event.
So what could drive a person, and I know I'm trying to ask you to get into the mind of an 18-year-old who you don't know, but what could drive a person to feel so infatuated, to want to carry out an attack like that? Or as in the case we just saw a couple of weeks ago in Brazil, there was a school shooting there where gunmen were trying to emulate the Columbine attack.
So in the case of the young lady that went to the Denver area, you know, her online diary, it's apparently her diary that's been published, and the kinds of things that you see in the diary certainly make you think about depression. There's a lot of nihilistic thinking that's in that diary, so feeling that life is meaningless, talking about feeling empty. But what's interesting in the diary is that that's turned in a direction of rage. There are drawings of guns, and references to violence. And so in some individuals, when they become depressed, when they have nihilistic feelings, they can channel that in a rageful direction. But what's interesting in this individual is that it's a young woman, and up until now, the high school mass shooters that we've seen have been men. And so one wonders whether she had been exposed to stressors like abuse that would predispose her to be violent.
What kind of impact will events like this have on not just the people who live in the area, we spoke about that already, but people who survived Columbine, who've grown up, who now have children of their own, and who are no doubt worried about them every second of every day?
It's very distressing. I think, you know, that after the Parkland shooting, those teenagers were saying, we want to be the last shooting, and they really built an identity around making sure that there would never be another shooting. And I had said back then that there are going to be more shootings, unfortunately, and that that's prone to be devastating towards the survivors of previous experiences. So I think that unfortunately it's an ongoing nightmare for those individuals to see that these events continue to happen.
All right, so you spoke about Parkland and some of Columbine's current students as well. They've launched a campaign right now to combat gun violence, and it's called My Last Shot. And it asks students basically to put a sticker right on their ID or their cell phone that would indicate their desire for images of their body to be publicized if they're killed as a result of gun violence. What does this tell you about the mindset of today's teens?
I think that they're really motivated to bring about change, and I think that they have a lot of wisdom in terms of looking at the role of the media. There have been guidelines that have been published by some professional organizations, mental health organizations, trying to give the media some tips about how to cover these events. For example, not to name the shooter, not to provide so much coverage on the shooter, which tends to glorify the shooter and make it more likely that they're going to be copycat crimes. And so I think that this kind of initiative to say we want people to see the result of gun violence on our bodies is a further effort to shake people up, initiate change.
Very quickly, did we as a nation lose our innocence in some way on Columbine?
I think we did. I think that unfortunately when these shootings happen now, people often shrug their shoulders and say, you know, well, it's just a Wednesday and another shooting. So I think that unfortunately that leads kids to feel even less safe.
All right, Dr. Ziv Cohen, thank you so much for being here.
Absolutely, thank you.